Good morning, Mofan. Good morning, Uba and Fardosa. Today I want to take you through some notes here on my laptop. I'm very far away, and right now I'm in Nakuru. I was unable to come to class because of family engagements, which was it was unavoidable for me to miss this, and also because I was needed. Just wanted to take you through some notes here, PowerPoint, and I would like you to go through it and be able to understand as we finish some of these units in introduction to community health. So I want to take you through, and after that I'll give you some assignment to do, and you will submit them when we meet next. So straight away I'm going to share my screen so that you'll be able to understand some of these things. All right. I'm going to the notes. I want to go through some notes here. What we call decentralization. Decentralization. So decentralization means away from the central point. So it is removing things from the central point, putting them away, or putting them away from the central point. So decentralization is the process of transferring power and authority from a central to a local authority so as to, one, plan, second, make decisions, and also third, manage. So decentralization is, we can see in Kenya right now, there's decentralization of power whereby there is what we call county governments. There is central or the national government. It has gone out to county government, so you can see the power is being decentralized. So in health also, health matters and community health, so this process is being applied so that plans and this decision making and management is done from the community level. There are forms of decentralization. One is deconcentration, second, delegation, third, devolution. Right, let me take you back. So forms of decentralization, we have deconcentration, second, delegation, and then third, devolution. I'm sure you are familiar with the word devolution, which is being applied in the county government. And then there is delegation, where you've had people delegating some duties or some maybe family members or management position delegating duties to other people. Then we have deconcentration, decongesting from the central point. Objective of decentralizations is to increase community participation in decision making, to promote local self-reliance, that is the objective, to give greater independence to lower levels of the system, to enhance the quality of service delivery at the community level, to improve coordination of services. So number one is to increase community participation in decision making, which is very important, and it is key, as we had discussed earlier about principles of community health. So community participation is very key to achieving the primary health care, especially in developing countries. So the objective of decentralization is to increase community participation in decision making on the ground. And also it helps to promote local self-reliance. That is, when the locals see themselves or identify themselves with projects, with their work, with initiatives, and which is coming from themselves, then they will be able to promote what we call self-reliance. It also helps to, the objective is to give greater independence to lower levels of the system, and then also to enhance the quality of service delivery at the community level. Decentralization will help to enhance the quality of service delivery at the community level. Then the other one is to improve coordination of services in the community level. Then this other one is to improve efficiency in resource utilization. Efficiency means using the best means, the least resources with the least cost, and to achieve a maximum result. That is efficiency. So to improve efficiency in resource utilization. Deconcentration. Let's see, what is deconcentration? Transfer of authority and responsibility from central to field offices of same agency. That is transfer of authority and responsibility, right, from central to field offices of same agency. You hear that? Field offices of same agency. So it's transfer of authority, one, and then second is responsibility, from where? Central to field offices of same agency. It's same agency. Deconcentration is the process by which the agents of central government control are relocated and geographically dispersed. All right, so they are relocated from maybe from Nairobi, and they are dispersed to different parts of the country, different regions of the country. So it's this process by which the agents of central government control are relocated. They are moved from the central point, and they are dispersed to cover the geographical, or in an area like a country, they are dispersed to cover the whole area. Administrative decentralization, that is transfer to lower level central government authorities or to other local authorities who are upwardly accountable to the central government. So you've seen those three: transfer of authority and responsibility from central to field offices of same agency, the process by which the agents of central government control are relocated and geographically dispersed, the administrative decentralization, that is transfer to lower level central government authorities or to other local authorities who are upwardly accountable to the central government. Right, delegation. What is delegation? Delegation is transfer of authority and responsibility from central agencies to organizations outside their direct control. So you've seen this deconcentration is within the same agency, within the same organization. But delegation means it is transfer of authority and responsibility from central agencies to organizations outside their direct control. That's now the difference. The difference is transfer of responsibility and authority from central agencies to organizations outside their direct control. What form? My son is talking to me. One form of administrative decentralization which transfers responsibilities and authority to semi-autonomous entities that respond to the central government but are not totally controlled by it. One form of administrative decentralization which transfers responsibilities and authority to semi-autonomous entities that respond to the central government but are not totally controlled by it. Delegation also is the transfer of managerial responsibility for specified functions to other public organizations outside normal central government control, whether provincial or local government or parastatal agencies. So you see that managerial responsibilities for specified functions to other public organizations outside normal central government control, whether provincial or local government or parastatal agencies. Then the third one is devolution. Devolution, transfer of authority and responsibility from central government to lower levels through statutory or constitutional measures. So this one is the transfer of authority and responsibility from central government to lower levels through a statutory or constitutional measures. This is exactly what's happening like now from the central government or national government to county government, and it is done through statutory or constitutional measures. The transfer of governance responsibility for specified functions to subnational levels, either publicly or privately owned, that are largely outside the direct control of the central government. You see that. So this is the transfer of government responsibility for specified functions to subnational levels. Right, devolution of healthcare at county level. With the devolution of healthcare management functions to the counties, anxiety looms over levels of preparedness of such an undertaking in all counties. So what's happening is that there is devolution of healthcare at the county level, and you've seen that the doctors, the nurses right now, they are under the county governments, being paid by the counties and other functions, and this is done through the devolution. This include an even inter-county levels of development, an equal distribution of resources of health space, especially distribution of health facilities, human resource, and poorly developed communication structure. So the term decentralization has been used to signify a variety of reforms characterized by the transfer of fiscal, administrative, and or political authority for planning, management, or service delivery from the central MOH to alternative institution. MOH stands for Ministry of Health. Ministry of Health. So it has been decentralization has been used to signify a variety of reforms characterized by the transfer of fiscal, administrative, and or political authority for planning and management or service delivery. A devolution is category of decentralization. So it implies the ceding of sectoral functions and resources to autonomous local governments, which in some measure take responsibility for service delivery, administrative or administration, and finance. So it is a category of decentralization, devolution. It implies ceding means part of that power of sectoral functions and resources to autonomous local governments, which in some measure take responsibility for service delivery. The Constitution of Kenya 2010 has assigned the larger portion of delivery of health services to the counties, the exception being the National Referral Services. National Referral Services. This implies that counties should bear the overall responsibilities for planning, financing, coordinating delivery, monitoring of health services towards the fulfillment of right to highest attainable standard of health. So this implies that counties should bear the overall responsibilities for planning, right? Financing, and you've seen the way now they are paying doctors, nurses, and so forth, coordinating delivery and monitoring of health services towards the fulfillment of right to highest attainable standard of health. Devolution is looked upon by majority of the Kenyan population as the answer to persistent regional disparities in the distribution of health services and inequities in resource allocation. So you've seen that many parts of the country in Kenya lacked variety of health services and health infrastructure. So, and now because of the devolution, this is now trying to bring what we call equitable distribution of resources. So it is looked upon by majority of Kenyan population as the answer. It is the answer to persistent regional disparities in the distribution of health services. There was a lot of regional disparities. You find that some of the health infrastructure is concentrated majorly in maybe urban areas in like Nairobi and some places in Kenya, and you find that some places in Kenya lacked this infrastructure, and it was because of the kind of system which was there. But then now the devolution is an answer to these persistent regional disparities, where the infrastructure is now being distributed equally in counties. However, the realization of this may not be immediate as a result of the current varied levels of unpreparedness within the counties. You find that there's so many in counties, they are trying to, some counties priorities are different, and you find that some are trying to address issues to do with maybe drought, issues to do with food insecurity, issues to do with road infrastructure and so forth. So you find that the priorities might be different, but eventually there will be a realization of this. So some counties starting at a relative disadvantage will take time to build up their capacity and ability to use devolved resources well, which may lead to even wider disparities. In the long run, the success of devolution will depend on availability of resources, both financial and human, for counties to carry out their assigned functions and their empowerment to use resources effectively. So you find that in the long run, the resources or the success of devolution will depend largely on the availability of resources, both financial and human. We need doctors, we need health workers, nurses, clinicians, and so forth, to be also as well to be equally distributed in these counties, and also the infrastructure, health facility to be built in order to realize this. Purpose of decentralization of health services. What is its purpose? Number one, to ensure department programs are more responsive to local needs. So this will ensure department programs are more responsive to local needs. And it also enhances community participation. This will help enhance community participation. And also local initiatives stimulation. Sorry for that noise. It's children playing around. So local initiative stimulation. Local initiative stimulation, that means it will stimulate initiatives in the local community. Then the other one is the purpose is relevance of decisions, right? The decision making will be done at the local level, and this now will help to streamline the relevance. Then minimize duplication. It will minimize duplication of things, of services, of work. So this will ensure that it minimizes duplication. It will also enhance intersect oral coordination. Intersect oral coordination. So you've seen that it ensures department programs are more responsive to local needs, enhance community participation, where the community will be able to participate in decision making, planning, and management, and so forth. There is local initiative stimulation. It will stimulate initiatives from the local. People now think and come up with initiatives that can help them address the issues affecting them in terms of health and also development. And also relevance of decision making. It will bring relevancy and also minimize duplication. Duplication, as we had seen earlier, that duplication is when there is duplication, you find that time is wasted and also resources are wasted. So when you minimize duplication, you'll have saved resources and you'll have saved time also. Instead of doing two things at the same time, then another thing will be done. It will also enhance intersect oral coordination, right? Oral coordination, intersect. What are the challenges of this decentralization? Decreases effectiveness of some functions, e.g. personnel hiring. It has been known to decreases effectiveness, aggregates national inequality, and capacity building is unequal. These challenges aggregate national inequality, and also there is what we call capacity building is unequal. Those are still the challenges because the country had been in a state whereby things were centralized mostly. Another challenge is used by the central government to abandon responsibility. So you find that the government sometimes, because they don't want to do some responsibilities, they decentralize it to maybe the county or local governments. That there is that challenge whereby they are not doing it in like good faith. Yeah, so you'll go read later that. And then I'll advise you read on the following: District Focus for Rural Development, Kenya Health Sector Strategic and Investment Plan. You can go to library, get that book, and then read it. Read that book as like a journal. It is called Kenya Health Sector Strategic and Investment Plan. You can go to library and ask a librarian to give you that kind of journal so that you can go through it, you read. You can also read on Comprehensive National Health Policy Framework. This one you can go to online and you can Google and read. And then you can also check on economic recovery strategy for wealth and employment creation of 2003-2007. Just check also on taking the Kenya Essential Package for Health to the community. We have these journals in the library. You can check on that. And then you can check also on the second National Health Sector Strategic Plan of Kenya. Read on those things and you will be able to you'll be able to understand more. So kindly read on those things and read more on this decentralization. I'll share these notes on your emails. So I would like you to check on those and be able to understand and be able to understand. Should you have any question, kindly send it via my email. Any question you have, send it via my email so that I can answer. And then when we meet again, we can discuss on that. The other one which I wanted us to check is what we call surveillance systems. Surveillance system. So let's quickly go through it. the surveillance system. Mhm. Right, surveillance. What is surveillance system and how is it being used? Surveillance systems. So, right, surveillance system, from the word surveillance or surveillance, it involves a lot of maybe cameras and all that, surveillance, checking, looking, and so forth. Hello Joyce, everyone after 10 minutes after getting yeah, so sorry for that interruption. Public health surveillance. There is what we call public health surveillance. This is ongoing, systematic collection, analysis, and interpretation of health-related data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this data to those responsible for prevention and control. This is the World Health Organization definition, information for action. So public health surveillance is, you can see, ongoing, systematic. So it is ongoing. Second is systematic collection, and then systematic collection, analysis, and interpretation of health-related data essential to the planning, implementation, and evaluation of public health practice. So that's why when you go to hospital, to health facility, you find that they take your biodata, your name, where you come from, your age, your sex, and so forth. They take those records, and it's for the purposes of public health surveillance. They want to check maybe how many times, where do you live, and they want to check on the diseases and what's affecting people. So it's very important, and this is what we call public health surveillance. It is very important in the health sector. So its purpose for it helps for planning and also for implementation and also evaluation of public health practice, closely integrated with the timely dissemination of this data to those responsible for prevention and control. You find that also organizations like Cambridge, research institutions like Cambridge and others, and also research being done by institutions goes towards this public health surveillance. It is helping in this area. Approaches to surveillance. One is universal surveillance. What does it mean? Choose entire population or a representative sample to monitor for conditions of interest. It is used in acute flaccid paralysis or polio. It's used in measles, used in food poisoning, bioterrorism agents, where they use kind of those. So this is what we call universal surveillance. Number 2 is sentinel surveillance. Choose key location to monitor for condition of interest. Locations might include sites, events, providers, animals, and stroke something. Okay, something is hidden here. Something is hidden here. Let me check. Stroke vectors. So it's animals, stroke vectors. So you've seen universal surveillance is you choose entire population or a representative sample to monitor for conditions of interest. And then this sentinel is choose key location to monitor for conditions of interest. So that's the difference. And then we have active surveillance. Active surveillance is periodic solicitation of case reports from reporting sources such as physicians, hospitals, laboratories, etc. Yeah, that's where I said when you go to hospital, they take data, they take your biodata, starting from your name, where you come from, your age, your sex or gender, and so forth. They take all those, which helps in this active surveillance. And maybe the disease you have, and maybe they ask you sometimes, are you allergic, and so forth. There's a lot of questions being asked there. So it helps in active surveillance, e.g. routine search of hospital records for cases of disease X in the discharge listing. So advantages of this active surveillance include can collect more detailed information, may be more representative. It can collect more information and may be more representative. Disadvantages, it is very costly. It also labor intensive. You need a lot of labor, and difficult to sustain over time. It is difficult to sustain over time. Then we have what we call passive surveillance. Passive surveillance relies on healthcare providers to report on their own initiatives, must make this reporting process simple and time efficient. So they rely on healthcare providers. They collect data, or they receive data from the healthcare providers, and they rely on those records. E.g., vast majority of surveillance systems are passive. Advantages is the cost. The cost is at least minimal cost. You have it is easier to design and carry out, and also useful for monitoring trends over time. It is very useful for monitoring the trends of diseases over time. Disadvantages is low sensitivity. It's not as sensitive as it should be. The amount of data available also is limited. The amount of data is limited, and again may not be representative. It may not represent the entire population as was designed. The major difference between passive surveillance and active surveillance is that passive surveillance relies on pre-existing data, or data that is usually reported by public health officers or healthcare providers to health departments, while active surveillance involves proactively collecting data from patients or participants from the general population. So you've seen the difference is that passive surveillance, they rely on pre-existing data, but active surveillance involves proactively collecting data. So that's a major difference. Some uses of public health surveillance, they include what? Detect sudden changes in disease occurrence and distribution. So they detect the sudden changes in disease occurrence and distribution. Monitor trends and patterns. They monitor trends and patterns. Portray the natural history of a disease. And generate hypotheses, stimulate research. So they generate hypothesis. Hypothesis in research is the conclusion that it has been made. Maybe, for example, they may say, for example, people get common cold or flu because of the dust around the city. So that's maybe kind of an hypothesis. So that hypothesis has to be like researched on to prove whether that statement is true or not. So that is public health surveillance generate hypothesis, and because of that it stimulates research. So after that conclusion and hypothesis, people will have interest to find out through research whether that hypothesis is true or wrong, to prove or to prove the hypothesis, whether it's correct or whether it's wrong. Its uses also is monitor changes in infectious agents. It's monitor changes, detect changes in health practices, and then evaluate control measures, and also facilitate planning. It has to facilitate planning. You can see in that poster, you can see that telephone call B, and then there is road traffic lights. You can see prepared. That's just a simple link to action. Outbreak investigation, disease control, vaccination prophylaxis, elimination of cause, interruption of transmission. So when there is an outbreak, the link to action is this. There is this kind of disease control where there is vaccination of prophylaxis, elimination of cause, and the interruption of transmission. So they interrupt. If it is malaria, you ensure that you clear the bush, you remove stagnant water, which is helping the breeding of mosquitoes, and you use mosquito nets and so forth. And then there is development targeting of programs, education risk reduction. There is that initiative where people are being educated on how to maybe ensure they live in clean environment to prevent the disease, prevent diarrhea, prevent themselves from malaria, sleeping under mosquito nets, and so forth. And then development of policies and regulations that will enhance health, especially maybe, let's say, the policy regulation one. An example is the one which was sometimes back put by the former Minister of Health, Charity Gillow, and they banned public smoking, and they designated some places in town where people can go and smoke there. So you find that if you are found smoking in the public, then you will be arrested. So those are the policy and regulation which have been developed. So the link to action is to ensure there is this area disease control, the outbreak investigation. They investigate what is the cause of this, and then disease control through vaccination, elimination of cause, interruption of transmission, and also the development and targeting of programs, and then policies and regulations. Challenges facing disease surveillance in Kenya, what are they? Number one, failure to report diseases of epidemic potential. That's one of the challenge. Another challenge is incomplete and late reporting. Incomplete and late reporting. So you find there is incomplete information, and there is also what we call late reporting of what's happening. The other one is inadequate analysis, especially at the periphery, at the outermost parts, or in the community level. There is inadequate analysis. There is also inadequate involvement of the laboratory in the case of detection, and this one also is causing a problem. There is also what we call inadequate involvement of the clinicians in disease surveillance. That's another major challenge. We also have what we call poor feedback to health workers and community. Poor feedback to health workers and community. And another challenge is inadequate number of staff. There are no adequate number of staff to tackle this area of surveillance. No, surveillance basic ingredients includes good network of motivated people. Second is clear case definition and reporting mechanism. Third is efficient communication system whereby information can be fast, easily, and quickly. And then there is what we call basic but sound epidemiology, right? We have laboratory support, then feedback and rapid response. These are the basic ingredients: good network of motivated people, clear case definition and reporting mechanism, efficient communication system, basic but sound epidemiology, laboratory, and feedback and rapid response. Surveillance is backbone of disease control. It's the backbone of disease control. How do we get there? How do we get there? Yes, there should be a roadmap, and it is a process. It is a process which takes place. So good surveillance does not necessarily ensure the making of the right decisions, but it reduces the chances of making the wrong ones. That was by Alex Langmuir. Then we have the reason for collecting, analyzing, and disseminating information on a disease is to control that disease. Collection and analysis should not be allowed to consume resources if action does not follow. That is by Forge, W.H. et al., Epidemiology, that was 1976. Now, community organization refers to what? Refers to a planned process to activate community to use its own social structures and any available resources, e.g., that is internal and external, to accomplish community goals decided primarily by community representatives and consistent with local values. Purposive social change interventions are organized by individuals, groups, or organizations from within the community to attain and then sustain community improvements and or new opportunities. So these are planned processes to activate community in order to use its own social structures and also the available resources. Community goals include pursuit of community health, which is informed by concepts such as physical wellness, mental wellness, emotional wellness, social wellness, environmental wellness, occupational wellness, etc. So community goals include pursuit of community health, which is informed by concepts such as all those physical and so forth, physical, mental, emotional, social, environmental, occupational wellness. Community health can be described or studied in the following categories: primary health care, interventions that focus on the individual or family, such as hand washing, immunization, circumcision. We have secondary healthcare activities which focuses on the environment, such as clearing bushes, spraying insecticides, and so forth. And then we have tertiary healthcare interventions that take place in a hospital setting, such as surgery. So we have primary healthcare, that is, which can be handled from the household, community level, things we can do like hand washing, immunization, and all that to prevent diseases. Secondary includes clearing bushes to avoid breeding of mosquitoes, spraying insecticides, and so forth, in order to ensure our environment is clean and so that we cannot contract diseases. And then the other tertiary healthcare intervention is the one which takes place in hospitals, where now you are treated or you are given medication and you are given medical services. 5-stage community organization process for health promotion. Step number 1, community analysis. The central components of community analysis are assessing community capacity to support a project, potential barriers that exist, and community readiness for involvement. Look, listen, and learn. So there is step number 1 is community analysis. Step number 2 is design and initiation. After having a basic sense of the community needs, and coalition priorities. The actual core planning group of the coalition must be established, composed of a handful of interested members who are willing to make a commitment to the coalition. This group must guide the actions of the coalition until a formal leader or board is chosen. Hence, their main responsibilities are to assist in the process of community analysis and priority setting. The core planning group should also decide upon a mission statement, as well as developing some short-term and long-term goals. So design, initiation, step 2. Step 3, implementation. Implementation stage requires that those abstract goals are be translated into clearly defined points of action. The strategies developed should not be one-shot deals or actions without reflection. After all, few public health problems are solved with short-term intervention. So this is where there is implementation take place. The plans that have been put in place, then it is being implemented in step 3. Effective coalition work requires multiple programs that are woven in a thorough and integrated manner. Step 4, maintenance and consolidation. Integrate intervention activities into community networks, establish a positive organizational culture, and establish an ongoing recruitment plan. So it will help in maintenance and consolidation. Then step 5 is dissemination and reassessment. As the coalition work progress, it is used to conduct a new community analysis and check for any differences in needs, resources, etc. In addition, updating the community analysis may help identify additional members for the coalition who are either new to the community or were previously not interested. So step 5 is about disseminating and reassessment. So you disseminate, you give out, you give out the information, and then you reassess as well, updating the community analysis, you update. That is the end of this presentation, and I want to thank you so much for your patience. And right now I want to say, go read those notes, go through it, and then I'll send you some questions via email, which you need to do, and so that next time we meet, we'll be able to go through them. I hope you've read the history of community health in Kenya. Kindly read through. Any notes, any question you have, kindly send it via my mail so that I can answer you, or I can collect those questions so that we can discuss when we meet again and be able to understand. We want to finish our units at least before mid-July so that you can have time to do your studies, your revision before your exams. So thank you so much. God bless you and have a wonderful time.